If you or someone you care about is dealing with eczema, you know it's way more than just a little itch. But what's the actual playbook that healthcare professionals use to manage it? Well, today, we're going to crack open the official guidelines for atopic dermatitis. We're going to give you the inside track on how to tackle this really complex condition. Let's dive in.
The first thing the guideline does is state something that anyone with eczema knows in their bones. It is so much more than skin deep. This quote right here, it validates the huge, real-world impact it has on every single part of your life. We're not just talking about skin, we're talking about well-being. And that idea, that's really at the heart of the whole strategy we're about to break down.
All right, first things first, how do the pros officially know it's eczema? Let's take a look at the absolute must-haves that they are trained to look for.
This is question number one, right? You have to get that clear, clinical yes before you can really start building an effective action plan. So what does the guideline say actually qualifies?
You know, it really boils down to two essential pieces of the puzzle. It's not enough to just feel that itch, and it's not enough to just see a rash. For a real clinical diagnosis, you've got to have both. The internal feeling, that maddening itch, and the external evidence on your skin. When you have both of those together, that's the classic signature of atopic dermatitis.
And you know where the rash shows up is another massive clue. Now, it can pop up anywhere, but it often tends to show up in these specific hot spots. We're talking about the creases of your body, like the inside of your elbows or the back of your knees. When a rash appears in these classic spots, it just makes the diagnosis that much stronger.
Okay, so let's say the basic signs are there. The next step is to dig a little deeper. The guideline really frames this as a team effort, kind of like a detective story, where you and your pharmacist are working together, gathering clues to figure out your specific case.
To get the full picture, you can expect some key questions. Things like, when did this all start? What have you already tried that didn't work? And this one's a biggie. How is this affecting your sleep? That's a huge indicator of how severe things are. They'll also probably ask about family history, things like asthma or allergies, which helps connect the dots on why it's called atopic dermatitis.
All right, now for the interesting part, the hunt for triggers. These are the things in your daily life that can cause a flare-up. The guideline points out some usual suspects, of course, like harsh soaps or scratchy wool clothes. But then there's the stuff you might not think about, like stress or even contact allergens like the nickel in some jewelry. Figuring out your personal triggers is, honestly, a game changer.
Okay, this is super important. A huge piece of managing eczema is knowing the difference between what you can handle with your pharmacist's help and when it's time to call in a doctor. The guideline is crystal clear about certain red flags, the signs that mean you need to level up your care.
So the guideline draws a really clear line in the sand. On one side, you have mild, localized eczema that's getting better with treatment. That's usually perfect for pharmacy care. But look at the other side. A painful rash that's spreading, feeling sick with a fever, or, and this is a big one, trying the right treatments for a week or two and seeing zero improvement. Those are your cues to see a doctor.
And then there are the don't wait, go now symptoms. We're talking blistering, any signs of an infection like pus or weeping skin, or a rash that's covering almost your entire body. These are not things to sit on. They are urgent signs that you need a doctor's attention right away.
Okay, with a clear diagnosis and all those safety red flags in mind, we can get to the most powerful part of all of this, your action plan. Let's break down the practical, day-to-day strategy for getting eczema under control, taken straight from the professional's playbook.
So the guideline lays this out not as one single magic bullet, but as a three-part system. Think of it like a three-legged stool. Step 1 is the foundation, just smart skincare and doing your best to avoid those triggers we talked about. Step 2 is the constant maintenance, using moisturizers every single day. And finally, step 3 is for active flare-ups. That's when you bring in topical corticosteroids, or TCS, to calm down that inflammation. The key here is that none of these work alone. Real success comes from using all three together.
This is the million-dollar question, isn't it? So many people have heard scary things about steroid creams. It's led to this thing that's actually called steroid phobia. And you know what? It's a completely valid concern, which is why the guideline addresses it head-on.
This quote right here is so important. The professional guidelines explicitly tells pharmacists to reassure people. But the key phrase, the one to remember, is when used appropriately. This is not about being afraid of these creams. It's about understanding how to use them the right way to get all of the benefits without the risks.
So how exactly do you use them appropriately? Well, the guideline gives us this super simple, honestly brilliant tool,
the fingertip unit, or FTU. It's just a standard way to measure out the perfect amount of cream. You squeeze it from the tip of your finger down to that first crease. It completely takes the guesswork out of it, and it makes sure you're using enough to actually work without going overboard. It's such a practical tip that puts you back in control.
Right. So, having an action plan for flare-ups is crucial. But let's be real. Eczema is usually a marathon, not a sprint. So, what does long-term success actually look like? This final section is all about the strategy for keeping your skin clear and building a lasting partnership with your healthcare team.
This is not a here's your cream, see later kind of thing. The guideline maps out a whole journey. It starts with an initial check-in, maybe a week or two after you start, just to see how things are going. And from there, it becomes an ongoing collaboration, all focused on one big goal, creating a personalized, long-term plan to keep your skin calm and happy.
Now get this. This might be one of the most powerful insights in the entire guideline. When a treatment doesn't seem to be working, one of the most common reasons isn't that it's the wrong medication, it's the underuse of the right one, usually because of those fears we mentioned. That's exactly why a simple tool like the fingertip unit can literally be the difference between failure and success.
So, to wrap it all up, let's boil it down to the keys to success. First, be proactive. Use those moisturizers every single day, even when your skin feels totally fine. Second, be prepared. Have that eczema action plan ready to go for when a flare-up hits. Third, be vigilant. Know your red flags and when to ask for help. And finally, be a partner. Open communication with your healthcare team is absolutely everything.
Look, at the end of the day, managing eczema is all about taking an active role in your own story. These professional guidelines, they aren't some secret rulebook. They're a toolkit, and they're designed to be shared. I really hope this gives you the knowledge and the confidence to move forward and write the next, much clearer chapter for your skin. Thanks for joining me.